wondered, is it ADHD or bipolar that is going on for your kiddo in your family? My name is Veronica Hunter with ADHD What Now, where we cover investigating the body and the brain, growing skills, and building great relationships. And of course, one of the questions that many people have is, what support do I get for my kiddo? How do I identify what's going on? And then what support can I get in place? And so today I'm delighted to welcome Dr. Kennedy of the Brown Clinic. And he is here to address for us, is it ADHD or bipolar, and tease out some ideas around emotional dysregulation for us. So welcome, Dr. Kennedy. It's great to have you here.
Thank you for inviting me. Hopefully we have a good session and answer some questions that are helpful to some people.
Awesome. Now, you are part of writing or wrote an excellent article in Attitude Magazine that was titled "When a Mood Disorder Looks Like ADHD and Vice Versa, Differentiating Signs of Emotional Dysregulation." And what I loved about that article was that it added a lot of clarity and just showed how well you were able to tease those or help people identify the details of that. So I'm hoping throughout this conversation, you'll share much of that too. So to dive right in, like, you have many families that are probably coming to you and asking what is going on. So when we're talking about emotional dysregulation, like, what does that look like? What do they come to you present with saying?
So at our clinic, we see little kids, teenagers, and adults who may have ADHD, or they're coming to see us for a second, third, sometimes a fourth opinion, because they are asking for some diagnostic clarity. And they've had treatments in the past, but are not quite successful in alleviating a lot of their difficulties. And as far as the emotional dysregulation, it's not something that's been put into the diagnostic criteria for ADHD, but it is an associated symptom for some people. But breaking down the emotional dysregulation, some people think that it's separate from ADHD or overlaps with another. And so for our clinic, we are able to see patients for 3 hours. And during that time, most of it is just me asking a million questions in a clinical interview to get an understanding of the person's strengths and difficulties, their family dynamic, and sort of the course of illness of things. And depending on their age, will steer some of the diagnosis, particularly if we're dealing with kids that are 12 and under. We're likely not to be thinking this is emotion dysregulation with bipolar disorder or a mood disorder, rather ADHD, possibly with anxiety, with depressive mood that's just beginning to erupt, or sometimes it's the parenting style between the parents. Sometimes if the parent doesn't have their own ADHD recognized, you can have this turmoil in the house between the parents. For adolescents, it gets a little tricky sometimes with puberty, where the surge of hormones is starting to happen, and some people that is just a temporary period of time, and some people like to think that they're having worsening ADHD, or do I have another disorder? And so in our evaluations, we really get a lot of time to use our rating scales, which are normed and nationally validated, so we can hone in on, is this more poor executive functioning in ADHD, or do we need to have another follow-up assessment? And sometimes we don't know. Sometimes with, like, for example, bipolar type 2, it takes quite a while to really get enough examples and seeing the person over time to see the patterns. With ADHD, it's much more chronic, day to day, and that is easier to recognize, at least for us in our clinic.
Mm-hmm. So can you describe what is meant by emotional dysregulation, first of all? Like, yeah, what does that core term mean?
So there are a few different definitions of it. How it fits with ADHD, it's not my favorite terminology for it because it's has so many other diagnoses associated with it. For example, with personality disorders like borderline personality, emotional dysregulation is almost a guarantee with that disorder. With ADHD, it's a smaller percentage. The range is somewhere between 30 to 70%. Um, and it has a lot to do with temperament, personality, and life circumstances and stressors. So the emotional dysregulation you see with ADHD is quick, it's over with, and then people feel sorry about it, and then but it happens in this continuous sort of pattern. But it's not something that's sort of extreme and out of nowhere and has the quality of that with other disorders like borderline, where there's a splitting of I hate you, you're the worst person in the world from one day to the next, and you're the best, and I love you, and so you can sort of see how the emotion comes out. For a lot of people with ADHD, it's uh, if it's untreated, it's the chronic frustration, the irritability, the easily discouraged. It's hard to snap out of it. And how you can see that sometimes is we do working memory testing. And for example, there's all sorts of working memory tests. One we like to use is using stories. So patients, they listen to two short stories, each about 25 word units. And as they're listening to it, they're trying to keep it in mind. And then when I stop, I ask them to repeat it back to me. Most patients, whether they're average smarts to very high IQ, tend to do poorly on that test. It's a rough test of working memory, but it tells me something about how well they can keep things in mind while doing something else. And that is a lot of the core symptoms, or the driver behind how the emotion regulation works for them. That it's hard for them to snap out of an emotion. It's as if like a computer virus takes over their brain. And once that emotion hits, whether it's discouragement, anxiety, nervousness, or depression, uh, when it happens fast, hard, and it's over quickly usually.
For ADHD.
For ADHD. So it has a sort of quick build up to it, and then it's over quickly. And for some kids, they can usually hold it together a lot at home. I mean, at school, particularly for fear of peer rejection, and they don't want to look bad in front of their teachers and have remarks and get in trouble. So some kids, when they come home, that's when you see it. With kids who are bipolar, they have more of the impulsiveness that can get a bit extreme, and they can get up in fights and arguments at school. So getting an idea of the location of where things are happening helps sort of steer the understanding of it.
So how often do they co-occur together, ADHD and bipolar?
So by statistics, ADHD is more common, has a higher prevalence rate than bipolar disorder. The emphasis on bipolar disorder is usually on bipolar type 1. Bipolar type 2 gets missed a lot. So the data for that, I think, is often underdiagnosed. But for kids and adults, the general consensus for ADHD is somewhere between 3 and 7 to 9%. And the overlap with bipolar disorder is as similar to that same percentage, but tends to be a little bit less. The bipolar 2 is a more sneaky to diagnose, but likely more prevalent than current data suggests.
Okay. So looking then, help us understand what is the difference, or what can we be aware of as far as ADHD versus bipolar, so that we can get to someone such as yourself that will help to tease apart those two things.
Right. So sometimes if we suspect someone has a bipolar diagnosis, we're going to use validated rating scales in our clinic to determine which is the priority diagnosis or symptoms, because these symptoms of emotional regulation can overlap between the two. But what else is there with their difficulties that takes priority? If, for example, someone has a bipolar type 1 diagnosis, then stimulants or ADHD treatment is not going to come first. And we're going to initiate some treatment plan to support the patient with bipolar 1 disorder, do a lot of psychoeducation. And if it's bipolar type 2, it doesn't always require bipolar medication, but it usually requires some sort of action plan. And that in itself is a lot of psychoeducation, which, if I have to repeat it several more times, that's essentially the most important part of getting people to really understand their illness and knowing that it can change over time. For both disorders, they usually run in families. So if someone is coming to see us, if you ask good questions and they start to think about people in their family, you'll usually be able to find someone, whether it's their parent or an uncle or a cousin. Both are equally as heritable. And science uses number between 0 and 1 to say how likely something to be passed down from the parent to their child. And in that scale of 0 to 1, ADHD is a 0.76 and bipolar is about a 0.8. So, and so most people, for either disorder, you can usually find someone else with it, and that helps give us a clue about which direction we may want to go for treatment. But I've had families where that becomes a bias as well. And because grandpa had, bipolar disorder, but without me having to verify that, the parents may have an inclination, oh, we need to treat this as bipolar. And we don't get the correct ADHD diagnosis. And sometimes it gets tricky to do this sort of the unconvincing of, all right, we need to, start from scratch here. But we do have, I like to use pictures in my clinic explaining sort of the course of symptoms. Like if we're talking about bipolar, this was just a drawing example of the highs and lows. And some people may feel like with ADHD that they could fit into this. And sometimes they do. But what we're really looking for is a long-term pattern of behavior and getting feedback from as many people as possible helps to see which diagnosis really is the priority for treatment.
Which is important because, as you mentioned, the treatment regimen is different depending on the identification of the problem.
Correct. So we really try to narrow our targets of what the difficulties are. For both, it's usually medicine with behavioral treatment. Okay. And particularly if, it doesn't particularly matter which diagnosis someone has, but having family support, friends, anyone in their community who helps understand them, so they can see the signs of it. If, say someone has a bipolar diagnosis, nobody knows when they may have an episode. They may only have one. They may have a type that comes once a year. So having someone recognize the early signs of it, then it can be treated. With ADHD, it's more of the day-to-day thing.
Okay. So what does bipolar 1 look like or mean?
So, bipolar 1 is just very distinct from type 2. Based on its severity. Most people who have bipolar 1, the symptoms are prodromal in their late teens, and the illness gets worse as they get into their 20s. That's the sort of the typical pattern of it. Same for bipolar 2. It's rare, very rare to see it in young kids. There's sometimes little signs depending on their temperament style, but generally you see it at their late teen years. The similarity that both have is their depressive symptoms can be just as bad. And people with bipolar 2, they usually stay in that state and they go to a normal mood. They only need one hypomanic episode in their life to have a diagnosis, which some people disagree with. But what that hypomanic is racing speech, racing thoughts, talking way too much, not needing sleep for a day or two or three, and then it's over. And it usually doesn't always impact their life. Sometimes these people can be very creative and make wonderful business deals and do a lot of great productive work with all that energy, and not cause any problems in their life, cause chaos. The other type, by type 1, usually ends up in the hospital because they're unstable and safe and they make decisions that are very risky. And sometimes it leads to hurting themselves or uh, getting too much involved in substance use.
So for bipolar type 2, what are red flags to be aware of?
So sometimes what you'll see is the buildup of it is I have all this energy, I'm not sleeping. Could be just, 3-4 days. They get more goal-directed behaviors, and if they're in their career or they're an artist, they're spending a lot of time awake doing only their artwork, and they could be making very beautiful stuff. There's nothing strange about it. It's just, hey, are you gonna get any sleep? And then sometimes that shifts to more irritability, and then they crash. And this is like 3 days, 4 days, maybe up to a week of just sleeping and not wanting to be around society. So there's this like this pit and peak to the disorder, but it's short lasting. And seeing that happen once may not be enough for some people that say that warrants an assessment. But when you see it happen time and time again, and it starts to cause a disruption to maybe the relationship with the people they live with, or forgetting to pay bills or something, and not taking care of day-to-day tasks, or losing clients. That's, as people get older, they start to see that, okay, this is more like bipolar 2, and you need an assessment for it. So that the emotional dysregulation, how that fits within all of it, can be tricky to separate between the two.
So bipolar at school and at home, what does it look like?
So with I have a young girl. She's in high school and she's an amazing artist. At school, she had a lot of trouble connecting with other people because of what she thinks of herself. And no one would know. It's not like she's walking around with a label on her forehead of, hey, I have bipolar disorder. But it's the symptoms that she's discusses primarily at home. Most people at school she tries to avoid because she doesn't want to let them in to see that side of herself. There was a really great New York Times article written in the 90s, and I think became a movie starring Anne Hathaway, Take Me As I Am. It's a wonderful story about a woman who's very successful and had two sides of herself. One that everybody knew, who she was very outgoing, she was funny and successful, and everyone wanted to be around her. But then when she would crash as part of her bipolar 2 phase, she would disappear. No one would know where she was, and then she would come back. Similar to my patient, she goes through those sort of she calls them like spells. And you can see it when she's at her best, and then when she hits these lows, the lows are pretty bad. But she doesn't ever get to that very, very manic phase where we're considering hospitalization. It's usually a specific medication protocol we have that helps that ramp up, calm down. And it's not something she has to miss school on. It just helps her reduce that level of intensity or energy that she has. So if she were to go to school, no one's going to notice that pressured, fast-paced speech, or, gee, you haven't slept in 3 days. So it helps sort of regulate her energy level.
Mm-hmm. Awesome. That helps clarify a lot. What other thoughts would you like to leave families with regarding emotional dysregulation, ADHD, or bipolar?
An important takeaway I give to a lot of parents is this philosophy we use here: if you catch more flies with honey than vinegar. And that has to do with your spouse or with your kids or how you deal with yourself. And regardless of your difficulties, you can't just say, okay, I have ADHD and that explains why these are my problems and I don't deal with it. But do be proactive about your diagnosis, have the right treatment plan. Sometimes you need a second opinion. Learn as much as you can about it in yourself and having your family back you up. I think that's essential for everybody. The medication's kind of the boring part in my follow-ups. I like to learn about how people are functioning. So I ask a lot of questions with parents while they're here or with their kids and try to see just generally how they're doing. And when they leave here, hopefully they feel good about themselves.
Mhm. Awesome. Thank you so much for being here today and for sharing about ADHD and bipolar emotional dysregulation and what some red flags are and how to get help. Very much appreciated. And where can people find you online and your practice? How are you accessible?
Thank you. Um, it was great to be here. The easiest way to get in touch with our office is through our website, brownadhdclinic.com. And you can visit our website. If you have an appointment, we have an easy button to click on to self-schedule, or you can just give us a call. If you have questions, you can email us, and that email address is right on the front page. It's the info@brownadhdclinic.com.
Awesome. Thank you. And we'll be sure to link to that address in the show notes too. And for anybody watching, put in down below in the comments what was useful for you about this conversation, and like, subscribe, and we'll see you later.